thank y'all for being here. So let me get this straight. We got city, we got county.
Yeah, we're not separated. We're
All
all
right.
friends.
And then we have Representative Thompson and I are the state. We don't have any feds, I don't think.
No.
So, but this is all good. We're all family. Representative Thompson and I are supposed to be in Jackson today. There's a little thing going on called a legislative session. And Representative Thompson, I had 2 requests for meetings at the Capitol today. And I said, I can't do it. I've had this on my calendar for a long time, and it was important that I be here as your state health officer representing the Mississippi State Department of Health, because the Pontotoc County Health Department is important. And it's one of our level 2 clinics, which means population's not big enough to have a nurse practitioner and do everything every day, but it's important enough that we need to be here to take care of those who need their shots, to take care of WIC, to make sure TB is under control. I said, you might get something when you go to Walmart, but it's not going to be TB. We take care of that for you. We invest in this county upwards of $1 million a year. Now that's federal dollars that flow out into your county, plus the money we put into this health department, because the health departments are a partnership. That's the way it is in state law. Believe me, the legislature does not provide us enough funds to run all the county health departments. And the counties don't have enough funds to run all the county health departments. We have to do it together, and then we leverage federal dollars every way that we can to benefit, especially our medium-sized and smaller counties, so that there's access to core public health clinical treatment throughout the state. And we are very proud to be here. My GPS took me to the old county health department. And I pulled up and said, well, I expect they did a lot of work on the inside because I can't see it on the outside. But y'all, I want to tell you, your old health department is really what you normally would see going around the state. Many counties just have not paid attention. These are all county buildings. This is your building. And we are grateful that you allow us a good building like this to serve your people out of. But there are many counties that we're still in buildings like the old building with very little hope of getting out of it. But I've been determined as your state health officer, the folks that go to the health department deserve clinics just like I go to and just like my family goes to. And our folks who need the health department, they need an environment of care that's respectable and compliant and looks like a doctor's office instead of looking like a 1950s nuclear bomb shelter. And I would tell you, when I became your state health officer 4 years ago, your old building was kind of the pattern. That's pretty much what I would see as I was out visiting health departments. I will tell you though, this is becoming the standard. So thank you so much. I can't thank you enough because I know it was hard. And I'm so proud you did it without having to adjust your millage. And now I can use y'all as an example of what counties do caring for their people by investing in their health department and their human service agency office and the CPS office. So this is important. It's important for your community. When you see a nice, healthy health department like this, it shows you have a strong, healthy community leaders who are taking care of their people. So I just can't thank you enough. I'm so proud. If you come visit me, and I hope you do, I have a map of the state of Mississippi right next to my desk with every county on it. It's got the public health districts. We have 9 of them. And each county that I've been able to visit and in their health department, I've got it pinned. And first thing I'm going to do when I get back to Jackson is put a pin in Pontotoc. Right. So glad to be here. Thank you for coming out to help us cut the ribbon, and thank you for all you do for Mississippi and this area. So thank y'all for having us.
1, 2, 3.